She's got a couple of minutes. She's busy.
Dr. Stebbins won't be.
That's
Right.
right.
Dr. Meade should
He likes to make a dramatic entrance.
be. Yeah, and as long as she's here, I don't care.
Yeah.
Lisa.
I go out to bed parking for her.
Lisa, how's the kids doing?
Good.
All healed up?
Or what?
Is it all healthy?
Yeah.
Back in school?
Well,
Good.
no, Kelly's in school. Jack's is virtual.
Oh, yeah?
Yeah, he just decided it'd be better to avoid the quarantine.
Sure.
To keep playing.
I think that's kind of what a bunch of them are doing.
Yeah, it is, yeah.
I know my neighbor.
He was a big help when we moved that shed.
Oh, good.
He, I
Yeah.
hadn't been around him much. I've been around AJ several times, but not
Jack's
him.
quiet.
He's doing whatever Dad told him. to do.
Good.
And-
It works out pretty well.
Yeah.
All right, I think it's 10 o'clock, so let's go ahead and get started. Call this meeting of the Crawford County Commissioners to order this 18th day of September 2020. Please join me in the Pledge of Allegiance. I
pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. We'll begin with the consent agenda. Are there any amendments to be made to the minutes of last month, the last meeting?
Mr. Chair, I move we accept the minutes from the previous meeting.
I'll second. Move on to signing of the motions.
And several motions from the last meeting to sign. The first motion is 20-385, that the consent agenda be approved. The second motion is 20-386, to recess this open session and go into a closed executive session for a period of not more than 20 minutes to discuss the health department director position under non-elected personnel and to include the Board of County Commissioners, County Councilor Jim Emerson, and Executive Director of Health, Mental Health, and Juvenile Services, Michael Healing, Ms. Janice Godeke, and County Public Information Officer Samantha Garrett, and to reconvene by 10:30 a.m. The next motion is 20-387, to appoint Ms. Janice Godeke as interim Crawford County Health Department Director. The next motion is 20-388, to approve the authorization for services from the Arnold Group to perform the first three services listed: employee handbook review and updates, job analysis and job descriptions, and performance management system, and authorize the chairman to sign. The next motion is 20-389, to recess this open session and go into a closed executive session for a period of not more than 15 minutes to discuss the noxious weed department under non-elected personnel, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 11:05 a.m. The next motion is 20-390, to recess this open session and go into a closed executive session for a period of not more than 10 minutes to discuss the employee evaluation process under non-elected personnel, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 11:17 a.m. is 20-391, to recess this open session and go into a closed executive session for a period of not more than 10 minutes to discuss the employee evaluation process under non-elected personnel, and to include the Board of County Commissioners and County Councilor Jim Emerson, and to reconvene by 11:28 a.m.
Thank you, Don.
Thanks, Don.
Thank you.
All right, we'll move on to the county health update.
Good morning.
Morning.
I've got the gating criteria update.
Thank you.
Dr. Bean, would you happen to have an extra one of these?
I do have some extras,
I think
yeah.
Father and Lisa and Janice possibly.
She's got one. I believe one for me. You need another or just?
No, I want them to have them as well. That's. Should I introduce our father?
Okay. Well,
Before we
good
start, I'd
morning.
like to introduce our father, PJ. Thank you for coming today, Father.
Very good. Well, Dr. Stebbins couldn't be here today, so I'm going to kind of go through everything. Mostly, I'll probably go through the gating criteria, which includes most of the numbers that we typically give. I think overall have a positive report today, which I am happy to say.
Oh, good.
I'm going to say guardedly optimistic, but we have felt pretty good about where the trend things have gone this week. So we'll just kind of talk through this. As of last night, we have had 75 new cases this week, which is down from 149 new cases that we had last week, and the week prior to that, 302. And I believe 302 was kind of our peak week. The reason this is still red, according to the gating criteria, they look at new cases per 100,000, and anything over 150,000 is still red. And when you adjust for our population, we are at 197 per 100,000. But we feel a lot better about 75 cases as compared to 149. Also included the breakdown of the cases for our new cases. So as you can see, we still are about 36% in that 18 to 24 year group. There's a little bit, we've altered the age range from last week a little bit to be more in alignment with how KDHE breaks down their numbers. So we're going forward, we'll start reporting in what we have for this week. But the 18 to 24 is 36%, 25 to 44 is 37%. So those are our two big groups that we're continuing to see the positives. And then you can see the actual number of new cases in each of those age groups. So overall, the trend for this week has been decreasing. The trend from last week was decreasing, but significantly more. So I've kind of labeled that as the yellow. And our current number in isolation, which is the active cases that we currently have, is 160. Significant decrease
Yes.
from the 548 that we ended last week, because a number of those college students and that age group student or age group individuals came out of isolation. So very good. PSU reported this morning that they currently have 20 in isolation. And expect another 10 to come off of that in the next few days. So trending down. Looking at the hospital capacity, med-surg as of this morning at Via Christi was at about 25%. Girard was at about 75%. And ICU at Via Christi was 16%. And ICU is about 50% at Girard. This fluctuates every day. We currently have 6 positives and 2 PUIs at Via Christi.
So we're down there as well.
So it's stable. It's
I
kind
thought
of
we had
been.
like 9 last week.
We did have some days that were 9. We also had some that have been 3 or 4. So it's kind of stable in fluctuating in that group. We do have one on the vent.
And that is COVID related.
That is COVID related, yes. So some days we've been in the green on capacity, some days we've been in the orange. I went ahead and kind of put it in the orange group, partly because of our current hospitals, but also looking at our referring hospitals in our surrounding communities, so Joplin, KU, because there's been several times this week that they've been on diversion and we've had to look for alternative referral hospitals for higher level of care, not necessarily COVID related for our transfers out, but for other things that require care beyond what we can do locally. And so that's a concern for us and something that is important for us to look at, because if we're having to transfer, and I think we talked about this last week a little bit as well, if we have to transfer further out, that takes our transport units out longer, which impacts us locally as well. So that's kind of what we're factoring into this as well. So that's kind of where we are from a healthcare standpoint of the hospital. We did have one additional death reported this week in a long-term care resident. But overall, we did add all of the long-term care, an invitation for all of the long-term care entities to participate in our 3 times a week call that we have in the morning, just to kind of update each other. And so this morning we had several on, all feeling pretty good about where their facility is, and I think have good plans in place and are monitoring closely and watching the situation closely. And for the most part, I think all of them are COVID-free. We do have one that has continued to have issues, but less than we have in the past weeks. Testing continues to be adequate. Our turnaround time is still within 24 to 72 hours from testing to getting results and notifying patients, which we feel is pretty adequate. Our contact tracing, we continue to have KDHE assisting with some isolation and quarantine, but I've moved it to yellow because because we've dropped off so many in isolation, we have been able at the local level to focus more on being able to take some new isolation cases. And I was going to kind of talk about, as we've talked about the health department update, some things that we have implemented this week, and contact tracing is one of those things, focusing on the K through 12 and making sure that locally we are doing all of that. So we'll talk a little bit more about that. So overall for our community, we continue to be kind of what Dr. Stebbins and I believe is moderate impact, although he and I talked this morning and feel like comfortable with the yellow as opposed to the orange. So I think improvement in that, mostly because our numbers are trending down, and we are still able to maintain hospital capacity. Looking at the schools, I think the schools look very good. For the incidence rates for the elementary age, we've had 2 new cases as of last night. We've had 3 new cases in the middle school and high school. Again, mitigation strategies appear to be very effective. Our trend is stable. Our isolation, which is the number that are active cases, have gone from 15 to 10, and our quarantine has gone from 365 to 153, because classrooms were coming out of quarantine this week. And that was 2/3 of the numbers last week were in school quarantine, so kids were still coming to school. And a good portion of the quarantine this week, again, is in school quarantine. So we feel pretty good about that. I think the schools in general feel pretty good about that, and so we maintain a low impact at the schools. Any questions on the numbers or anything before I kind of give some updates on the health department and some things that we've done a little bit differently this week?
I have none. I'm just happy to see that
Me
it's
too.
trending down.
We are happy to see that
We
as
had
well.
several weeks there where it was trending up,
Sure.
so
Yeah.
that's good news.
Yes, it is. So obviously, this week has looked a little bit different. Janice has been apart since Monday. We're happy and very appreciative to have her back, and with her knowledge, transitioning back into just kind of keeping everything running smoothly. Dr. Stebbins and I have also spent quite a bit of time at the health department this week with the epi nurses and just trying to get a better understanding down to the nitty-gritty about processes and things, and getting their input about things that we feel that we can improve in some of the challenging areas, some of the things that Commissioner Blair had visited with us about on Friday about prioritizing the schools. The epi nurses also felt strongly that that was an important thing. And so we have, starting this week, we have prioritized that the epi nurses locally will manage all new positive cases in school, so students and staff. And they already have had really good communication with the school nurses, talking to them probably multiple times a day. So continuing with that, because every school has an epi nurse assigned that works with that liaison at the school. And so they will also work the quarantine of the classrooms, of the individuals. One of the kind of breakdowns that sometimes happened was when there was a family exposure that resulted in a quarantine of a student that was maybe getting worked by KDHE and kind of fell through the cracks. And so I think we found some ways to communicate so that everybody is aware of the ones that are related to school and maybe the ones that are not related to school from home contacts, and have implemented or are in the process of implementing a shared document that the epi nurses and the school nurses can see and work on together so that they have real-time updated data and working through that. And both entities are very happy about that. So I think that that's going to be something that's really good. One of the challenges that I think has been identified is that the multiple release dates were maybe being communicated to parents and families and all of that, and I think we've identified where maybe that was coming from and have done some pretty simple implementation of just how we do the quarantine orders and the isolation orders a little bit differently, that should solve that problem. So I think that is very good. And as the isolation numbers go down and the local epi nurses have more capacity, the next priorities that they're going to look at working are the long-term care cases, any outbreaks that we have identified, and then others as needed. And so they feel that's very manageable. We feel like that's a good priority. So I appreciate that was brought to us so that we could get that in place. I think that's all really for the health department. K through 12, update on that. Dr. Stebbins and I had the opportunity to go to the Frontenac school board meeting on Monday. We both felt like it was a very productive, very good meeting. Able to, and this is something that we were able to do before the start of school at some of our other districts. We did that at Southeast, we did that at Pittsburgh before the start of school, just to kind of talk through the process and the reasoning behind the mitigation strategies and all of that. And so we had the opportunity to do that with Frontenac. Had very good questions, very good dialogue, and we felt that it was a very good meeting. So we also yesterday had a superintendent Zoom meeting with all of the superintendents just to kind of touch base with them, to fill them in on some of the things that we'd identified at the health department level that could help with communication. And most of the challenges that they had been experiencing, the things that we'd already identified to put in place, I think will take care of that. And so they are aware of that, and we think that over the next week, we'll see improvement in those issues. And I don't know, Jim, if you want, Jim was a part of that meeting too. We mentioned that there was an interest in having another update between the county commission and the superintendents. So we had Jim as a part of this, just for timeliness. And if you want to kind of give an update as to
Sure.
how the superintendents kind of felt about how things are going.
Yes. So there was a lot of good discussion yesterday on the meeting. Items that we talked about in here for a few meetings that I think were addressed and are going to be addressed with some of the new procedures that we've implemented to allow them to see real time who is in quarantine, when they're going to be off quarantine, and just getting all of that figured out with the EPI nurses. But what they wanted me to bring to the meeting today is just the appreciation they have for the county and the relationship they have with the county that's come out of this 2 or 3 month exercise. But they want me to make sure that they say that. They appreciate what the county's done, what our public health officers have done, the health department, to get us to a place where we're still having school, we're still in school, about a month later, maybe for at least one district or two, we're still able to hold events, and that's not true in more and more schools that they've talked to throughout the state and even in the region. So they're really appreciative of that. Communication is always the issue, and I think we're going to help solve that with some of the items that we're putting in place. But overall, it was a really good meeting, and they appreciate what we've done to keep. There's some short-term pain, but it keeps things open. It keeps events happening and extracurriculars happening, so that students can still feel like it's school, even though it's a little bit different. They really appreciated that. So, is that okay?
And I think, and we so appreciate the work that they have done and how much that they have worked with us, because it is not easy. But I think we are to the point that we are definitely starting to move ahead and stand out as that these practices have worked in, as much as we didn't want to have the surge in numbers in our community, it did test the things that we are doing to show that those things do work when you've got a community outbreak or community spread, as we have had. And it has allowed for us to be able to, for the majority of students, be able to maintain in-person learning and even extracurricular activities. And we know that without those things in place, schools are closing. And our superintendents know even more than us, because they talk to other superintendents all over the state that are experiencing if you don't do it, this is what's happening. And many of our, schools are having to go play teams far away because the typical teams that we're playing within our league are not able to play. So I think we all feel like it has been a very successful exercise. It is giving us data that will help us to be able to make decisions going forward as our numbers go down about what are more acceptable alternatives, which is what we've looked at from the beginning of this, and what alterations will we be allowed to make in the coming weeks or months to try to get back to even more normalcy, which is what all of our goal has been. So I think overall, schools very, very positive from administrative level, from our level. So we feel good about that. What questions?
Dr. Bean, I don't know if Dr. Stebbins had sent you a list of, I think there was 3 or 4 questions. Can you talk about them for a little bit?
Mostly questions related to what numbers are we most afraid of, and kind of fear of the virus and those kind of things. Is that kind of what
Yes.
you're referencing to? And he and I have talked about this because I think they're very good questions. And, you know, one of the things that he and I both have tried to focus on as we have been presenting since we've been in these roles is that we don't want fear. We haven't tried to have fear tactics. We want knowledge, and we want the public, and we want you and everybody that is making decisions to understand the why behind things and the impact, which is what ultimately our focus is on, our impact on the community, our impact on the healthcare, our impact on businesses, and our impact on the schools and students. And that's total impact, not just, you know, do they have COVID, but what is happening to them as a result of mitigation, and what emotional things are we dealing with, and that's where our, you know, common sense and our science and our data pillars have been our guiding forces. Is because we don't want any of our decisions to come out of fear, and we don't want any of our decisions to come out of misinformation or misunderstanding of information. And so that's what we've tried to really focus on, and have a healthy balance between numbers and science and common sense. And so I don't really think there are numbers to fear. There are numbers to pay attention to and to plan for, which is exactly what we have just been through in the past 2 weeks. And, you know, had we had, you know, the numbers that we had 2 weeks ago of 302 new cases, a lot of places would have just put into place a stay-at-home order and shut everything down and say, we're not going to do anything for 2 weeks. But it wasn't necessary, and I think we've proved that wasn't necessary because we were able to target strategies to help contain and decrease the numbers. And my hope is that will continue because of those targeted changes that we have proposed. So I don't think that there are really numbers for us to fear. There are numbers for us to pay attention to and to make appropriate recommendations based on that. What else?
Lisa, do you have any questions for Father?
Yeah, I don't know if it's a question so much as a statement, I guess. I guess one of the questions would be more just a statement question. I deal with the other side of this, meaning, and I have all the respect for, I haven't worked with you necessarily, I don't think necessarily directly in the hospital, but I've been right by Dr. Stebbins' side as somebody's dying. His bedside manner is incredible. He's an incredible doctor, and I commend you for everything you're doing on the physical side of this. The other huge sides of this are the spiritual and the mental side of this. And it has affected people more deeply than we are acknowledging, especially in the nursing homes, especially in hospitals. Doctors know as well as we priests do that if somebody is not willing to fight mentally, if they're not willing to fight spiritually, they'll pass. They won't fight a disease. And, you know, when we have people in the hospital that can't see it, and now we're doing better, obviously, but when they can't see their loved ones, I have to fight as a priest to get into the hospital still. I'm on staff up there. I mean, they gave me a card, they registered me. I showed them my card and they won't allow me in. I don't know what happened with that. I don't know where the breakdown was, but we have a difficult time even getting in to see people when they're on their last leg, unless it's during regular visiting hours. Much less their family, their loved ones, when they're passing. So these things are affecting people, and my fear is that we're kind of pushing that aside. So that's one of my fears, is that we're so focused on the physical health side of this that we're not paying attention to that side, even though we're trying. I think we're trying to bring that up and to keep that in the forefront. That is being pushed to the side. If you want a good story on that, go to the medical lodges in Frontenac. They had, I can't remember how many deaths in a month's period, more than they had had in the 6 previous months there. Not a single one of them COVID related. All of them basically due to loneliness. And you say that, and people are like, well, you don't like to die of loneliness. Yes, you do. You know, those people give up. And it's mostly because their caretakers are wearing masks. They're the people that they see, they don't get to see their faces. That matters to people. It matters. It matters out in society, it matters out in public. So, I understand the physical side of this, I absolutely do, the things that we're putting in place. But I think we also have to pay attention to how far we go with this, how long we drag this out. You know, I realize it hasn't been here for a year, but for, what are we, almost 9 months now? 8 months, we have been living in a certain amount of fear. And fear does affect people, so there's that. And then the other side of this, I think that we're going to run into in society that I've dealt with, because I have people on both sides of this thing, all over the place. And I've got
Right.
chirping in my ear all day long.
I understand.
Right.
We know
As do
exactly what
they,
you're
I
talking
as do
about.
us.
I got
and
one in my
that's-
ear all the time. But, so the other side of this is, and I understand disease, and I understand watching someone suffer. I have to do it all the time. To suffer at their end, and people suffer who shouldn't have to. And so I understand that this has been very bad for certain people, and it has killed people, and this is it can be a very deadly thing. But I think what we're going to run into, and what I'm having to answer for, is the numbers death-wise, the numbers severity-wise simply are not there. They simply aren't with this. And like I said, I have all due respect for Dr. Stebbins, but I listened in last Friday to the commissioner meeting, and when he talked about the person who got online and said that, you know, these people aren't sick. And he was right to say that's false. You know, that's absolutely false. These people are sick. They have an illness, and I agree with that. They are sick. They have an illness. But Dr. Stebbins countered with, immediately with, I've seen, you know, what they look like in the emergency room and how they suffer. Well, that's been a very low number, thank God. But it's been a very low number. And so what we're kind of faced with is the reality of the severity. And that was my question on, one of the questions I posed about why should we be afraid of these numbers? Because primarily that's what's been happening. We've been able to implement these things because of fear. You know, in America, you can't implement something to a free person's without fear. They have to first be afraid of this in order to follow these rules, because these are still guidelines. You know, there's no cops out there arresting people yet anyway, for not having a mask on or whatever, but it's fear that drives this. Well, my fear is that what do we do when that fear goes away? Because it is going away, because people are seeing these numbers that decrease daily across the nation. You know, so I just think we have done a lot of ruling by fear in this, and it seems like every time we turn a corner, every time something good happens, we get somebody else that comes out and says, no, now we need to fear this. At first it was deaths and hospitalizations, that's what we were afraid of. And those went down, and they have consistently gone down. We've had spikes, but if you look at the numbers, they have consistently gone down across the United States. And with, like I said, with the exception of spikes, those have consistently gone down. So then we changed the goalpost. Then it was, the numbers are increasing. Well, of course they're increasing. This is a virus. You know, your mother told you when you were a kid that, you know, if you caught something if you got an infection, you could treat it. If you got a virus, it was going to spread. The cold, if it moved through the school, everyone was going to get it. The flu, if it moved through the school, everyone was going to get it. So it's a virus. So, like I said, the changing of the goalposts. So that's, I think, a fear that people have, and I think it's a righteous fear. Are the goalposts going to move again? You know, what will the next goalpost be? You know, the numbers are declining right now. What's the next goalpost of fear that we're going to put out in the society that's going to perpetuate some of the actions that we're taking? And like I said, I'm not a doctor. You guys know best about how to protect people from this and how to decrease the chances. But at the same time, we do have that impact of loneliness that is certainly devastating our society without us maybe knowing it or acknowledging it. It is devastating our society right now, and we also have, that grip of fear that we're ruling by right now. And I think eventually that goes away. Is that healthy, or is there a better way for us to come around to getting people to jump on board with this, as opposed to this idea of fear? I don't know. Those are those are my questions.
I really appreciate that, and I think I can give at least my perspective on both of those points, which I think are very good and very well articulated, and I appreciate that. I can speak from personal as far as the measures that how they have negatively impacted, especially long-term care. My mother is in a long-term care facility in Houston, so you can imagine the lockdown that they have because of the number of cases. And I have seen the negative impact of her not being able to take visits home to be with my dad, and the only interaction they can have are window visits. And for someone who, is struggling with some dementia already, that is extremely negatively impactful. And so I agree, there has to be a balance between the negative impacts of what we are doing and the positive impacts of what we are doing. Unfortunately, and Dr. Stebbins and I weren't directly involved, but some of this comes because of lack with a novel pandemic where we have never experienced this virus. We've never experienced anything like this before. Making decisions along the way that you feel is appropriate based on what you know. And then as you learn more, not changing the goal necessarily, the end goal, but learning more about the impact of the virus and whether it is, initially it was deaths, but then as we learned better treatment options and being able to prevent that, what we are now seeing is more long-term consequences, even in younger people. And Dr. Stebbins talked about that, as far as the inflammatory process that can happen in the heart and, all of those kind of things. So there are different things that emerge over time just because of our knowledge of the process. That being said, our growing knowledge about what things work, what things are most priority, and what things can we return to normal, and our priority would be visiting those in the hospital and visiting those in the long-term care and re-engaging those relationships as soon as possible. Re-engaging normalcy in our schools so that our schools are not having to manage so much of a pandemic and just allow for learning. And those are our goals as our public health officials in our region, is to look at when and at the safest possible time, re-implementing things to return to normalcy. Unfortunately, we've been doing this way too long. We've had restrictions way too long because back in March when we had no virus, we were functioning off of what was going on in New York City and what was going on in Kansas City because we didn't know anything else. And so those that are responsible for public health and those that for our state and for our country put into practice the things that they needed to based on the numbers as a whole. Was that right for Crawford County when our numbers were 0? Looking back, absolutely not. And, at the time, I'm like, I don't know why we're doing this because we don't have it here. There are things that you can do to reduce the influx of it, but we were going off of what we knew at the time. And, that's where I feel like Dr. Stebbins and I both, our priority when we came into this role is that we want to do what's right for our community at the time our community needs it. And fortunately, we have more allowances with that because we haven't just shut down the whole state. We do have control over the decisions that we are making for, with guidance from the state still. But we know that Crawford County is different than Sedgwick County and different than Johnson County. And I think we have proved with the things that we've done with back to school that we can be back to school, we can be back participating in activities and doing much more normal things than most schools across the country, which I just heard last night. New York City has postponed coming back again because of the fear of teachers have and all of that. And we don't need to be making decisions off of what New York City or California or anything else, any other state, or even other places within our state. We need to be making decisions based on what we are seeing locally. And I think the thing, unfortunately, we were faced with a significant influx of the virus in our community at the same time that we were returning to school, and the same time, multiple things happening at once. And so, which I think is not necessarily a bad thing, because again, it has tested our systems and our logic behind things and shown to be effective, while at the same time, as we return to numbers closer to what we were before a few weeks ago, we can apply the same logic and relax things in accordance with the impact of the community. And that's what our goal is. It does take time, though. This is where that 2-week cycle is very, very important, because the impact in being able to medically care for our community lags behind the numbers. And that is what we as health officers have to watch for, because if we overrun our hospitals and cannot take care of our community, we do become a problem. And that's what New York experienced, and that's what places in California experienced, and why they had such massive shutdowns is because of the volume in the hospital that they were not able to manage. And do I think that we will ever be like that? I don't think so. We don't have subways. We don't live on top of each other. We kind of, we're rural, or mostly rural, and we socially distance naturally. But we do have to learn from those things and take them seriously. And then as soon as we can comfortably identify that we are in a place where we don't have to do as many of the restrictions, that is why Dr. Stebbins and I have been we will be very much of an advocate of doing what's right for our community. And I just want to continue, and he and I have been reassuring every group that we talk to, because everybody wants to know, when is this going to be over? I want to know when it's going to be over too. But it is not something that we can see a decrease this week and say, okay, we're in the clear. We have to see what comes up in the next couple of weeks. But I assure you and everyone that the decisions that we make want to be based on what's going on in our community. And that is more than just the healthcare piece of it, because we also look at the harms. And that was part of our recommendations that came out to the schools when we reopened, that we want to keep kids on-site learning at all costs, because we know the harms that happened when kids were out of school starting in March. We know tremendous harms, not only in falling behind in learning, but the social and emotional and the physical and all of those things, which is why we also advocate for activities, because the kids want that. And I understand, because Dr. Stebbins and I both have kids that are school age. I have one in quarantine right now, so believe me, I understand the consternation of parents, because I have to hear it from my son all the time. But it is a difficult time, and it's unfortunate that followed such a long period of time that probably didn't need to happen, but we were working off of what we knew, and we know so much more now. And I can assure you, we will make educated decisions that's holistic, and not just this number means this, or, and a moving target. And I can appreciate how it appears like it's a moving target. And part of that is when we look at, you watch the news and you hear everything is global. It's the United States, the numbers are trending down. And that's fine, but back in March, the numbers were trending up and they weren't trending up here. So what was happening in the country was not impacting us and should not have impacted us as it did. And, you know, we always lag behind just because of the nature of being middle America. And so this is our surge and we can respond to it in a sensible way. And I don't believe that we will have the long-term shutdowns. I mean, we're not shut down. I hope we will never get to that. But I know churches in California are being fined if they have meet together. And we will never advocate for that because we do know that the social and emotional is as important as a very important part of health. So I appreciate that, and we're right there with you. We understand, and we all are hearing both sides as well, and we are trying to live in the middle and live in the logical, best practice, what's right for us in our communities.
Thank you.
And I just add something. My daughter worked in hospice for several years. And one of the things that I found out, my aunt, when she was going into hospice, was that Medicare plays a big part on what nursing homes can and cannot do. So my thought here is that Medicare plays a big part in long-term facilities. And sometimes they come through with their rules. I mean, when my father-in-law was in a nursing home and we wanted to take him out for the day because he was on oxygen, there was all kinds of red tape and things we had to do, not because of the nursing home, but it was all because of Medicare.
Yeah.
Because if you don't follow their rules, you can lose some of their services. And I don't know what their stance is on COVID, but I know that they would probably rather pay their day-to-day bills as opposed to someone that now has higher needs because of COVID.
Right.
And I think probably your concerns might be.
Yes, I think that's an excellent point, and you're absolutely right, because CMS does have specific guidelines about reopening of nursing homes, and all of our nursing homes have reopening plans, and a lot of it is based off of numbers. And we have talked about this before. Numbers are important, but they're not everything. And so I do think as we have implemented targeted things to bring down our numbers, that will then allow the nursing homes to fall out of that red zone, and we can continue, and we are working with them to reinstate as much normalcy as we can. And I think we are all learning what things we should prioritize, and I think we can apply that to nursing home and give recommendations on that as we get through and hopefully continue to see a decrease in our community numbers.
As far as numbers go, I did have a couple of questions.
Yes.
So it is good that the isolation numbers have dropped. Like, that's really impressive. That's nice
Yeah.
to see. Where are quarantine numbers at?
I don't know. Do you have, Janice, happen to know the current quarantine numbers? I know we were about, let me see, I didn't have them for today. The last one that I have,
I'll see if I can get it in just a second.
we were down under, I think it was Monday.
We dropped off massively.
We
'Cause
were.
It was north of 2,000.
It was north of 2,000. I think we were right at about 1,000, maybe even just a little under 1,000. 992.
Well, that's good news. I
Yes.
mean, that's
Yes.
still a big number, but it's
Yeah.
not.
And that's, again, where that 2 weeks, because if you're on quarantine generally for 2 weeks, 2 weeks can make all the difference as far as both isolation numbers and quarantine numbers. So it might be much more manageable for us to be able to track those quarantine numbers. The challenge we were having on tracking those is because so much of the quarantine, 100% of the quarantine was being managed by KDHE. And there, if you've looked through the website at all, it's very great information, but it is very far behind, as far as even more than 2 weeks behind, because that's where I get the weekly positive percent numbers on here. And I was updating 2 weeks ago this morning because more numbers were going in for that. So our weekly incidence rates is what we're tracking locally. And so, it can be applied. And that's why the weekly positive percent has never been as important to me as the incident rate. That to me is more of the focus. But that is the challenge with tracking some of those numbers, is because the information on the KDHE website and from that EpiTrack system is behind as far as when things get inputted in. So
I gotcha. And along those lines, I'd gotten a question about the states, although I think they might have ceased it or changing it now, their cluster reporting
Yes.
information. So can you talk a little bit
Sure.
about that?
So I don't know, I haven't looked to see, so the cluster reporting, or kind of the outbreak reporting, I think in the last week kind of became a thing, because my understanding is it was just starting to be reported. And I know personally that community health was listed as an outbreak or a cluster. And after further communication with KDHE, because we very closely track our internal numbers, part of that is for community health, where we have multiple clinics across multiple counties. They were counting everything as one, as if all of the cases were occurring in one facility, when in actuality it could have been in 5, 6, 7, 8 different facilities. And so they looked at that differently. And the other thing was, because of lagging information, a cluster in healthcare is anything over 5 cases within a 28-day period. And we had 10 cases back in June across our whole organization, and those should have fallen off, and lagging information they didn't. But so that was actually not completely accurate and has been updated, and I'm not sure if they're going to report that anymore.
That's what it sounded like, that they were
yeah.
going to cease and look at modifying that.
Right, that's the same thing that I had heard, that some of the data was from the meatpacking incidents.
Right.
I noticed that when they had that up there, that
We still
sugar
had
was.
our cluster from June still
Sure.
on there. I think that was part of the issue, was that it wasn't current data. So how was it reliable if you're still
Right. And I
talking
think
about clusters from months ago?
the reasoning behind even having that was so that individuals can be well informed about businesses that they go to or healthcare entities that they choose to utilize. I don't think that it was realized that, especially with lagging data, if you don't really understand that, people may choose to delay healthcare even more than they already have. And that is ultimately going to be much more harmful, because healthcare facilities have mitigation strategies. We've had mitigation strategies in place to protect our staff and protect our patients since March. Very, very strenuous ones, including allowing for alternative visits. So, I think it was to empower the people, but it is really, if you don't have, as we've talked about all along, if you don't have real-time accurate data, sometimes that can be misleading and more harmful than helpful. And I think that was kind of determined and decided,
Right.
so.
When you'd mentioned, I can't remember the context now, but local outbreaks before, as far as paying attention and tracking those, are we, like, what does that look like currently?
Well, so currently, outside of our, college age students that we continue to work with PSU very closely on, we have not necessarily identified a significant outbreak anywhere else. Now, there are certainly businesses that have been impacted as a result of this increase in the last 2 weeks with perhaps multiple employees impacted either by isolation or quarantine. But there is nothing current that would drive us to make any targeted changes in anything as a result of cases. Seems to be more community spread as opposed to a outbreak. Does that make sense?
Right, yes,
Yeah.
I think so. So I mean, as you kind of reported, our numbers are looking much better than they were even a week ago. I guess the one that is kind of concerning to me is the hospital capacity, since it's now shrunken considerably, and I'm assuming that the situation in Joplin with all of them being in diversion and us not being able
Sure.
to send people elsewhere is maybe a little worrisome.
Sure.
I mean, I don't know if there's a question behind that, but like, it's concerning to me that that's
Well,
where
but
we
this
are.
is
and-
what we expected. This is what, this is what Dr. Stebbins and I have said all along, that the healthcare impact lags behind, and we are in that lagging period. And we will continue to probably see some impact because as we start to see higher percentages outside of the 18 to 24 age group, that is where the impact is going to come. So we probably haven't even seen the full impact of that. But again, by reducing the numbers and all of that, and just keeping an eye on it and keeping close pulse on what's going on, then we can address it as it comes. But this is not necessarily a surprise to us, and this is why we knew it was so important to make the changes that we have made to decrease the spread as much as we can. And we've been successful at decreasing the spread. We have yet to see the full impact of what that surge is from a healthcare standpoint. And that's why I said we need people to be patient with us, as far as we don't see the decrease in numbers and we instantly can change what we're doing, because we haven't yet seen the full impact. Once we get to a place where we feel like we've seen the full impact, then we can start making decisions about what can we do in the community, less restrictive or different than what we've been doing, assuming that we then don't see a negative impact.
What kind of information are you looking for that, like, I guess, how do you know we're at a point that we've seen the full extent of it as opposed to where we are right
I
now?
think if we, in the next few weeks to month or two, we will know what the spread is as a result of our increase in 18 to 24-year-olds into those other age groups that are going to have more severe illness as a result of it. And if we can keep, if we see that number stays manageable, and then I think we will feel good that we are able to meet the needs from a healthcare standpoint for where we are in the community.
So are you expecting then that like those numbers will get worse than they are right now as far as the hospital capacity, especially moving into
Yes, it's
flu
possible.
season? And
It's possible, but keep in mind, a lot of the mitigation strategies that we've implemented for COVID will also help with flu. So we are hopeful that we'll have a good flu season, and there's flu vaccine. So we definitely encourage people to get their flu vaccine and, reduce the chance of severe illness as a result of that. So it is yet but I will not be surprised, and we kind of anticipate that the hospital is yet to be fully impacted yet.
I mean, is there, I don't know what the word is, like a tipping point of like that? Because I mean, as you've said, what we want to avoid is filling up and then not being able to treat
Right.
people that are sick. Like, are there indicators
And having
leading
staff
up to that?
capable, and having enough staffing capability too,
Correct.
because that's the other thing, if your staff is all out sick, then that burdens the healthcare system as well.
Correct.
So the tipping point would be a couple of weeks of not seeing rising numbers in the concerning age group and getting past the point where the ones that are currently ill do not go on to develop severe illness requiring hospitalization, which is 7 to 10 days after they become positive. So there really is that 10-day lag behind everything. And we've gotten through the 10 days past the young, healthy people, but we didn't anticipate that would cause a significant impact in the healthcare realm, because they will get better without treatment. It's the spread from that group to the other groups is, and you can see, the 25 to 44-year-olds, which are still, for the most part, lower risk than the 45 to 64. But there are a number of people in that age group that have other healthcare concerns that can make them more at risk. So it really is just looking at the whole picture. And each week we will have a better idea and be able to give you more of what we anticipate. But it's still a few weeks out before we know for sure.
I think that's all the questions I had.
There have been a couple of things come in by email on our YouTube channel. Anyway, this one is basically about the state mask mandate and enforcement of that. They've said they've been in a lot of stores and seen people not wearing masks, but they wanted to know who enforces this mandate, and is there like any type of fine for stores that do not enforce that? And that's
Right.
the question.
So all along, really enforcement is really been businesses asking patrons to wear it, or strongly encouraging or requiring. And we did see a significant compliance with masking as businesses have embraced that. There is no fine, and you're not going to be arrested for not wearing a mask. But in order to, and I think many businesses have been very on board with this, because they have been impacted with staff, and some of them have had to close for a couple of weeks because of the number of staff that have been positive. And they know that this, as a source control, so if I have it and I don't know it yet, will reduce the risk to their staff, and their staff reducing the risk to their patrons. We have seen a lot of compliance with that. So the thing is, and this is what we look at, is if we see that there's not compliance with it and it has negatively resulted, which is what happened a couple of weeks ago, then we did have to make targeted restrictions to enforce it. And so that's what our role is. The health officer is to identify where it's impactful and what needs to be in place to improve it, with the help of the county commissioners and all of that. And we did. We saw improvement in that age group as a result of that reason for spread, because of the orders that were put in place. And when we do hear a concern about a business that may not be following the orders, then we visit with them and make sure that they understand the need and the why.
I did have another one here that talked about test results. They evidently have a child that was tested and they haven't received results. It's been several days. What do they need to do?
So the main thing is to contact the facility where they were tested.
Where they were tested?
Yes, because they will, for the most part, most of the facilities are, I would say, 24 to 72 hour turnaround time. There's always some things that can in individual cases, delay, like if specimens don't go out at a certain time, that can delay when they start to get run and some of those things. So there sometimes can be some delay. So I would, definitely reach out to the facility that you're awaiting test results from. But we are not seeing as a whole the issues we were having with turnaround time that we saw, I don't know, a month to 6 weeks ago when we weren't getting results. We were swabbing and we weren't getting results back for 10 days. That's not acceptable. We're not having that issue now.
Thank you. Then I've had a few come in. Anyway, there was one that was expressing concern about house parties. They think that they, I guess, observed that the bars were in Pittsburgh were packed and there were several house parties. It's why are they being allowed to be packed when we have a county order stating that they are not supposed to be? Is the question. So
Well, nobody's being allowed to be packed. So if there is a concern and we can be notified of the specific concern, then we can address that.
So because the order was about how people are
Capacity,
spaced out and are supposed to
be seated in cohort
and
groups.
things like that. So
Correct.
They see that, they need to bring it to somebody's attention.
Yes.
How has that aspect been going?
As far as,
Well, after we put the order in place, like, have there been complaints? Have we been fielding those, or how's that
I
going?
think a few of them actually closed for a couple
they
of
did,
weeks.
mostly because of staffing, I believe.
Uh-huh.
Staff were affected, and so they weren't able to be open because we haven't closed anybody. And I don't know, and Janice probably hasn't been there long enough to know if there's been anything come in. We did have one as far as a restaurant that we are in the process of investigating and working through. I personally have not heard of concerns about any bars or anything like that. So I would definitely encourage that if somebody has a concern, they reach out so that we can investigate and find out.
Do
and
they,
address.
just for public clarification, do they need to reach out to the health department, or do they call law enforcement as a first step?
They can reach out to the health department if it's not an emergent situation.
Starting next week, our phones are going to be automated, and one of the automation choices will be healthcare concern.
Perfect.
Good.
Very good. Okay. I know that people have asked about that.
Sure.
One last thing I thought of this earlier, on the testing, it is said adequate. Could you maybe define what that means?
Yes, and that's a broad thing. Adequate means that we feel like for our ability to manage a patient and get timely results, that the testing that we have, we are able to test everybody that needs a test. We are getting decent turnaround time in order to manage decisions on that patient. And we feel like they're accurate tests. So that's why I feel like it's adequate. If we were not able to test, everybody that needs a test because they're symptomatic, that would be a problem. When we had the very long turnaround times, that was a problem, and that would have been mentioned in this. But we're fine as far as testing. Now, ideally, many of us are still waiting on rapid testing, which will improve things even better. And that's kind of beyond our control, and that will be a help, especially as flu starts to be in the picture. But no, we feel comfortable with where we are for testing capability.
Where are we as far as rapid testing?
Well, I know at Community Health, we have received all 30 of our Abbott machines, and staff is trained. We are waiting on test kits.
Is that the holdup now?
That is the holdup. And hopefully I'll know maybe
Because
today
we
if they're going to
received
be.
the machine, the test, but we haven't had the, what is
The
it?
kits, yeah.
The kids
For the
yet.
Sophia at the health
So I
department?
meant, that's
Correct, it's the same issue.
been a
Yeah.
I
while.
have some kids.
You do have kids
I
now?
have some
Oh,
kids.
awesome.
For the Sophia.
Okay.
Are you have Sophia?
No, we have the Abbott. Mhm.
Good.
So that is good to know. So we can talk about how many of those and how we would, with limited capacity, we might have to look at prioritizing. Obviously, probably
Correct.
Healthcare workers and first responders that need testing quickly would be a priority for rapid testing if we have to prioritize based on the number that we have. And so we'll look into that and see what our capacity is. Hopefully, when our other entities get the rapid testing, then we will be able to do much more widespread rapid testing. But keep in mind, I know it is nice as a patient to know instantly if I'm positive or negative, but if you
Sure,
are
right.
symptomatic, which is primarily who we are testing, you're not going anywhere until you are over your symptoms and fever-free. So if we know that in 2 to 3 days,
Right.
that's the amount of time you need to stay home anyway. And so what was not good is when you're better and you still don't know your test result, and that's a problem.
Correct.
And we are not there now.
Okay.
So,
Thank you for clarifying
yep,
that.
sure.
I did have one more question that came in, and they were concerned that with the PSU is testing fewer students. Is there a possibility that some of those students are ill and choosing not to get tested just so they don't have to isolate?
That is always a possibility. I don't know. I don't know if there's a way for us to know if that's the
Sure,
case.
what you can do about that.
Although, we will see it spread more, so that is another reason that we keep a close eye on this every week, because if there are individuals out there that, are choosing not to and spreading it, ultimately it will kind of surface. So again, that goes back to personal responsibility and, seeking health care if you're sick, and to determine, if that's a concern, so that we can reduce the spread. And then also the things that we talk about, the face coverings and the hand washing and the social distancing when we are out and about, and maybe not realize that we're that sick, or we think it's allergies and it, maybe isn't.
That's all I had.
Okay, thank you.
One last logistical question.
Yes.
Is this publicly available?
So we have this ready to go onto the website, or is it already on there?
If you can send an updated one, it's not already on there.
Okay, all right. So I think our shared one is up to date. So what I would like to do is, there's a few numbers that I would like to, like the total Crawford County cases that we put on. KDHE does not update theirs till about 12:30. So
Correct.
what I'll do is update everything one last time after we get those numbers, and then we can add that to the county website.
Awesome, yeah, because this is incredibly helpful from
Sure.
both a historical perspective, but also it
Sure.
gives a lot more information than just a couple categories.
Yeah,
of
even
this.
this though, and that's what we've talked about, is we'd like to have some narrative to kind of go along with it, because
Sure.
even this, taken out of context, can be misconstrued, and that, we don't want to add to that. We want to try to help with clarity as much as possible. So
Right.
part of this is maybe the reason that we haven't got it up there too quickly, is that we want to think about the narrative that needs to go along with it to kind of help explain it.
Right.
Much like what we do here, but, people will only read a couple sentences, so it has to
Right.
be.
Well, I wonder if having some kind of printed something or other, like, that includes these numbers, but also an explanation
Right.
narrative, whether that's weekly or
Sure.
whatever, similar to what we've had here, but
Sure.
not everyone watches these meetings, so something that people can point to and say,
Right.
this is the update of where we are, an explanation of the rationale and thinking. of
We've
where we're
also
at.
talked about having a commonly asked question, because we get the same questions coming, and
Yes.
if we can just put that down in one place and have people that are, a place for people to be able to, similar, KDHE has that and CDC has that, but answered in the way that we answer it, and our reasoning behind things, so.
Like that, if you haven't gotten your test results,
Right.
call
Right.
whoever tested you,
Yes.
call that provider.
Correct.
Right.
Yeah, I think something like that would be really valuable.
Yep.
Does anyone else have any questions in the audience? If not, Randy, why don't you tell us, how's the ambulance department holding up? We'll give Doctor a break here.
Oh, thanks.
We had quite a few of our personnel that were positive for COVID. I think we've got all of them back but 2 at this point. So we're getting closer to back to normal again. There for a while, we were pretty short-staffed, which affects the hospitals because we can't get their transfers out. Like she said earlier, our transfers are now long-distance transfers. Used to be we went to Joplin, which is basically a 2-hour turnaround, and now we're looking at 6 to 8 hours for a turnaround for my trucks. Going to strange places. We've been to Springfield multiple of times, and that's not some place we normally go. I guess Kansas City's starting to refuse a few of them, so it's impacted us greatly in that aspect because I don't have a truck in the county for 8 hours at a time when we send transfers, and we'll get multiples in a day's time. So we're doing the best we can. We sent a memo out when I had some personnel out to let the hospitals know that our staffing, we normally try to staff 4 trucks, and we were doing good to staff 3, which, you know, affects everybody. We staff for emergency, be it, you know, county emergencies or what have you, but we do, part of our job is also getting patrons from point A to point B in a higher level of care. And so hopefully I can keep everybody healthy and we can get back to business as usual, but we've hopefully got through the rough time, and like I said,
Good.
I only have a couple out still, so.
Thank you. Sheriff, do you have anything?
Well, as far as us, we are still 0 in the jail. I don't know how that's possible, but I mean, probabilities tell me that we should have some in there, but I think our mitigation strategies have worked also. And so, yeah, we were still at 0. We've had somebody in personnel. They're already back. They're fine. 0 deputies or any of the sworn officers on patrol. Again, probabilities tell me that it's coming, but we still haven't had any. So we're hoping the precautions that we're taking are working. You know, unless we're having to, you know, fight somebody, we don't have to get as close as Randy's crew has to when they're taking care of somebody that's having a medical issue. But right now, it's business as usual as best we can, and we're kind of crossing our fingers. But it seems inevitable that, you know, we're going to have some cases, which could be crippling for us. But we have done some, you know, for example, our dispatch center. We have pretty much locked our dispatch center down, so there is no traffic going in and out of there. If they come out, they got to wear a mask. If I go up there, I wear a mask. I don't even go up there very often. That is the hub of our facility. So when they're dispatching ambulances and deputies and fire and that kind of stuff, if a deputy gets sick, you know, the admin guys can definitely jump in and take calls, and we're glad to do it. But if we have a communications officer get sick and we start getting crippled there, we really have people that can come in there and do those jobs. So we're trying to protect them as much as we can, and everybody in there. But that is would be crippling for us if we had some dispatches go down. So again, I don't know if we're just lucky or if our mitigation strategies are working. I'm hoping it's both. But that's where we're at right now. We're still limiting access to our lobby, and we're quarantining inmates and arrestees as they come in and trying to keep them from getting into the general population until they've been through their 14 days. So, see, I don't know. We'll see what happens.
Well, good work so far.
Yeah,
That's
thank
good
you.
news.
Keep it up. Thank you.
All right. Anything else from the health update? Janice, did you have?
I do have just a little bit here. As Dr. B, well, that's good. As Dr. B stated, they have been at the health department multiple times, and I tell you, that is so much appreciated. They've talked directly with the epi nurses. You know, I think, you know, we've practiced this for years, the response in a pandemic, and communication is always key. And I'm thinking, you know, with Dr. Bean and Dr. Stebbin coming to the health department, really working directly with the epi nurses they just feel a lot better. They just really do appreciate that a lot. And then we had the communication, or the meeting with the superintendents, and they kind of communicated they need a little more closer contact. So I have texted each, I've got one left to do, but most of the superintendents with a contact person, a nurse that covers their county. We have nurses assigned to each school, so they can have direct contact with them. So I hope that communication, helps. These girls have been working on some really poor equipment, and so we've ordered some new computers in for them. Unfortunately, there's kind of a supply, issue there, but as soon as we can get those, they'll have those. As well as we've put in some landlines into the epicenter there to where it's really hard to hear on some of these track phones, and you get the connection's not real. So we've put in some landlines there as well. I'm off the floor running here, and so this is just kind of hot off of the email this morning, is that we've got some extra funding. Kudos to Rebecca and Heidi, I think, for working on this. We got $300,000 to do community, helping with isolation and quarantine in the community, with bilingual issues, Spanish and that, and as well as lower income families, to help them through isolation and quarantine, and probably like some case management type issues there. So that, and then we got $477,000 for testing. So
Holy cow. That's
so
awesome.
yeah, so we'll be working on that. Like I said, I haven't got all the details because it just came off the email this morning. So I just want to let you know about the increased funding that we got, and we're rolling.
That's fantastic.
That's good
Great
news.
Yeah.
Yeah.
Thank you, Janice.
Thank you, Janice.
Happy 1 week anniversary.
Yeah.
All right, is that all for health update then? Awesome. Thank you guys so much.
All right.
Appreciate all
Would you
that you've
like
done.
to take a 5-minute recess?
Yeah, we can recess.
And let our doctor get back to
Yeah.
being a doctor.
I'll move that we recess the meeting for 5 minutes.
I'll second.
No more too long. Everyone one time.
Commission meeting back in session. Moving on, do we have anything else from public officials or public comment? Seeing none, we'll move on to new business. Dawn.
I just might make a couple of comments. We've had a lot of inquiries in the last week, well, going on a month probably, but more frequently in the last week anyway, about these drop boxes for ballots by mail. And I just thought might be a good idea to kind of put that, make it more public than on a case-by-case basis. But our plan is we are getting 2 of those boxes from the state. We won't have them until they're hoping the first week of October. It could be the second week, which the 14th is the first date for the general election. We will start mailing out advance ballots on the 14th of October. We hope to have them up before then. We will have one at the Judicial Center out. I need to get with Hippie, but out there's kind of an island of concrete curbing kind of in the middle of the parking lot almost. That would be a great place to install that so people could just drive up, put it in the back, not have to get out of their car, put it in the box.
And that'll be empty daily, correct?
Yes.
Good.
And then also one here on the edge of the driveway that would be where they could just drop them off without actually having to get out of their vehicle. And those would be picked up daily. They would be on election day. We would empty that out. We would have people there at 7 o'clock to empty them. That would be the last time that any ballots would be allowed to be picked up out of those boxes for counting. So just kind of some information on that. We'll have more as it becomes available, but I want people to understand where they'll be and kind of know that and be prepared to have them there. And if that's I guess a factor in a person's decision as to whether they want to do a ballot by mail, to know that that'll be in place. So anyway, that's all I had to say. If you guys have any questions.
I've had several questions pertaining to that, and the information was made available to them, and they were happy to hear it, and I think we'll see it get used quite a bit.
That's what I've had 2 or 3 phone calls that I've, in the last couple of days, that I've addressed it, and I just think it's important that, when you have that many inquiries, there's a lot more people out there wondering the same thing. So try to answer that question ahead of time.
As far as the Pittsburgh election goes, I think I'd seen a thing on the elections Facebook that people are able to vote, early voting in the courthouse?
Yeah, and we're doing that in the courthouse right now.
Okay.
We will have, I was trying to think, I believe that is October the 2nd. We're going to have 1 day of early voting at the Homer Kohl Center. And I need to get that out in the paper, but we will, I'm pretty sure it's October 2nd. It'd be from 9 to 6 there. Then, yeah, we're doing it in our office right now, and we'll be through, we have to shut that off the noon of the day before the election, so October 5th at noon, that would be discontinued, and then we'd have the regular full 4 polling sites open on Election Day, October 6th, from 7 a.m. to 7 p.m. People can vote by mail. We sent out a few hundred ballots by mail Wednesday of this week, the 16th. So, but people can still apply for those. They can go to that ksvotes.org, fill out an application right there, and it'll be emailed to us, and we would get a ballot in the mail to them the next day, or they can call our office and we can send them out an application in the mail as well.
Now, I looked at the KS Votes website, and it had looked like you're only able to, because you have to specify which election you're requesting a ballot for, and it only had one, when I got on there, for the general election.
Okay, I'll have to look at that. There may be something we need to send to them to have that. They may not be aware of that election. They probably, statewide, it's a statewide thing. They may just have the primary in general because they know everybody's running that. But I will check into that, because that's a really easy way, and we get a lot of
Yes.
applications from them we did for the primary, and we are for the general, so I want to make sure that that's available right now as well for that Pittsburgh election. So
And the last day to be able to request an advance ballot for that.
it would be, it's basically a week before Election Day, so it'd be
Okay.
September 29th.
Okay.
So that gives it time to go out, get that ballot out in the mail and back to us, so.
Cool.
Any other questions? Anyway, I just thought it'd be good to make a little
Yeah,
public
that's-
announcement about that.
Yeah,
Yeah,
Thank
thanks
you.
for the update, Don.
thanks, Don.
I might jump ahead, sorry, Jim. So Samantha has to be back in Pittsburgh by a certain time, so I was wondering, I was going to request an executive session with Commissioners Council and Samantha for 15 minutes regarding the PIO position, if that's all right, if we
I'll
do that now.
second that. I also have executive session today, but I don't know that, if you have to be in Pittsburgh, that's totally understandable. So,
Okay.
let's go ahead and do
Go ahead and do that
yours.
now then. Yeah, that's fine.
Was that a motion?
Yes, yep.
Second.
How long was that for? I'm sorry.
15 minutes, yeah.
Okay.
Resuming our, oh, did she leave her? Oh, yeah, that's not good. Oh. All right. Continuing on in new business, Jim.
So this is somewhat new business, but it's an issue we've talked about several times, and I know Commissioner Blair wanted to be here at the meeting, but he told me that it's okay to say that he's waiting on a test result. So he could not be here today. Wanted to make sure they're following the rules, but you wanted to bring up K7, and I think it's okay to go ahead and bring up, the sheriff's out in the hallway, maybe we can get him in a second, but we're still having, had at least one or two this week, injury, accident
geez.
this time, not just the rollover, so, yeah, he's back in here. Sheriff, I'm talking about K7.
Oh, yeah, we talk about that again.
Yes. I think just to get it back in front of, make sure that it's, the KDOT's aware, because the last time that we had them in, I don't think they necessarily were tracking the amount of accidents that were happening there. So to at least bring it up again. I know it's in their system to be
right.
worked on, but perhaps if there's some other things we can do, they can do with us to make that safer, because it's not going away. And you see it, what we have at least one this week.
Yeah, you know, since the last time we talked about this, we've actually had a break from it. So, I mean, you know, sometimes there's no rhyme or reason less. And most of it is absolutely, it's a narrow road with no shoulders. And again, the one from yesterday, why'd you take this route? GPS took me as being the quickest route. That's why they're taking it. Drop a tire off, and, you know,
Oh, geez.
it's
These are
absolutely.
the semis.
Yes, I mean, that's what it is. I mean, and luckily so far, it's just been single vehicle semis. I mean, luckily we haven't had a passenger car involved.
Right.
And, which was a little scary yesterday because we had two at the same time. We had a semi versus a car south of 4th and the bypass, and then we had that, which I thought that was the semi versus car, which was very concerning up there. But it ended up being an injury accident with an occupant and driver of a truck. And again, they dropped a tire off, rolled the semi. Of course, it seems like it's always got a load on it, which means now we're going to be hours. And, you know, first and foremost, it's a safety issue. It's a safety issue for the drivers. It's a safety issue for the other people on the roadway, sharing the roadway with these truck drivers. They don't know any better because they're coming from an enhanced roadway south of Girard, or they're coming from Kansas City, and then they get on that stretch north of Girard to Bourbon County. And so, so far this year, we've had 13, and I can tell you the one from yesterday almost took 12 hours for that road to get reopened.
Oh, my God.
And so not only are we having a safety issue, we're having a disruption issue with traffic, be it, you know, other truck drivers coming from Kansas City or coming from the south trying to get through. And you have that going both ways, north and south. And then the other issue that we're seeing a lot is the property owners. I know the one yesterday was upset, and rightly so. He's got a brand new $14,000 fence that got destroyed. And so, and then if you're having a medical emergency, you know, we had to cut part of a fence to help these people. And then you got to help unload the truck. And so it's hours and hours of the wrecker being up there. KDOT's out here at the four-way stop having to man it. And so by the time you get law enforcement there, highway patrol got there, you're helping shut the road down. It takes a couple units up on those hills because you have to have another deputy back further to make sure somebody doesn't come over that crest of hill and hit people. So then you got to call Bourbon County and try to get them help. So I did contact the Bourbon County Sheriff yesterday, because we're kind of in this together, because they just had one last week north of the county line that affects us just the same. So we still have to shut down here. And so I've got a hold of Sheriff Martin to see if he could get his stats. So I'm not too sure we don't do a collaborative thing. I don't know if with our commission, their commission, I know both of us are slated to have that widening and improvements, basically from Girard to the county line and from the county line, Bourbon County, up to 69. So I don't know if that's something, if we put a letter together. I would guess the KDOT guys are so tired of being here that they're getting it from that side too. But it can never hurt to try to draft a letter or something in terms of trying to get.
I think that would probably be a good idea, that
Yeah.
maybe we try to do a letter together and get it in the appropriate hands with KDOT. And I know that they've talked about putting shoulders on it and maybe.
And it's slight, it's ready, I mean, if I understand, it is, I have it, it's on the list, but we have no timeline. So if there's some
Right,
way
well,
that we can get
Maybe that's what
that,
we need to try to work out, is to get the project moved up due to the accidents, the number of accidents and now injuries as well.
yeah, I don't wanna see anybody get killed from that. I mean, we're lucky, we have 13 semi-rollovers, in almost basically the same stretch of highway. And a
That
trucker
should tell
hasn't
them
got killed,
something.
and luckily a passenger car coming by there at the same time hasn't got killed. But again, probabilities, the numbers tell you that something is gonna happen if it doesn't get
Right.
addressed. And it has to happen at the state level, but at the same time, if they're getting input from us, because at the same time, we get input, because I think a lot of people don't realize it is a state highway and it's up to them to address it, we can definitely voice our concern and try to get it, and we can do some, law enforcement on the speeding and stuff up there, but it doesn't change the structure of that road. And when there's no shoulders and you have people that are unfamiliar with this road and they've had a great highways north and south, they're gonna drop it. There's no room for error up there. And so if we can get that addressed through a letter or collaborative with Bourbon County, because they're seeing the same thing.
Jim, can you notify their attorney up there and maybe try to get something going on this and get it before both commissions and try to get a letter to KDOT and see if we can't expedite the project?
Yeah, if we could pin them down on some type of date. I mean, it can't happen quick enough, but if we can try to get something rolling on that.
I
Because-
suggest maybe sending it to our legislators that are responsible for those areas.
Absolutely.
They might, that's another place where pressure could be applied.
Well, it's just one of these things. As soon as it happens, you're like, okay, is anybody hurt? You figured that out. You get that taken care of, and now it's hours of a highway being shut down. And that affects, our local drivers and businesses too, because I have some that'll text me, is 7 closed down again? Yes, you're gonna have to take a different route. And so, we try to get it on Facebook and try to get it out there, but most of the time they figure it out when they get up here, but it's just, it's all around a very, a big issue that needs taken care of in all directions in terms of safety, property damage, and man hours up there of directing traffic.
I can see that. So that's something I could think of we can do at this time.
I believe so too.
We're doing this with good road conditions in terms of, here we are coming into winter
All right,
time.
what's it gonna be like this winter?
It's just, it's rough up there.
All right.
Thanks for the update.
That's all I have.
That's all? All right, Tom? New business?
Yes, I was wondering, Jim, could you kind of brief us on where we're at with the Spark funding? I had received a text a little while ago from a gentleman that said that he had, but he had got notified from the state today. Said, got an email today regarding Spark funding. Is there anything that they need to do at this point?
No. Let me give you an update on where we're at.
Okay.
So, from back a little bit further, so obviously we submitted our data by the August 15th deadline. here a week or so ago, we received kind of KDOT's, the Spark office, sorry. Request for information on a few of our requests, just asking for some clarification. We received that about a week ago. We're ready to submit that in. In the meantime, then they have given us a technical advisor. And the technical advisor had emailed me yesterday that if we had any concerns or need any help as we go through the remainder of the process, to let her know. And what I emailed back is 3 questions, but one of those questions being that if out of the items that we sent in, the ones that weren't picked by the Spark for more information, then are we able to go ahead and start processing some of those areas that there were no questions? Can we go ahead and start doing the MOUs, getting the paperwork back, and start mailing checks? I've not received a response to that yet. So that's kind of what we're waiting on, is one, to submit some of the answers that we had to the questions, but then also when will the green light be? And is there going to be a partial green light if some of these items were basically not commented on? Are those approved and ready to go? That's what we're trying to figure out. If we get the okay on that, then we can go ahead and start sending out MOUs.
Do you think that would possibly be today or Monday or?
I'm not sure. I'm hoping to get a response today from the email. I have not seen it yet. I know that Mike Bodensteiner and Greenbush had kind of given an update that they've put on our website to kind of let people know where we're at, kind of some of the same things that I'm saying, that we've kind of done our part. It was a lot of information in a short amount of time. We're waiting on the state for the go-ahead. So we cannot start submitting MOUs and cutting checks until we get final approval. That's where we're at. We're looking for clarification. If we're a go on the rest of our direct spend, we can start moving. But as for now, we feel like we need to wait until we know some answers. So that's our plan, to get some answers. And it'd be great if we could start sending out MOUs next week.
Good, okay.
Can't guarantee it though, Tom.
Right, no,
Yeah.
I know, and I understand some of these people, they need it, and they're,
Right.
we kind of thought it might be the 15th.
Yes, we
Yeah.
did. We were hoping to get a green light. We got partial okay, but some things still needed clarification. I mean, there's a huge run up to this, and the deadline, and now everybody's just waiting. So, yeah, we'd love to hear a go ahead from the state.
I guess the other question I may have pertaining to that is, I've had a few people ask if there's going to be a third part to this, that they weren't aware of the first and second. And, at one time we thought there would be.
Yes.
And I guess at this time, we're just waiting to see if that's a possibility.
Yes, so what we'll do is, as soon as we're able to start processing MOUs, start sending out money, and this may not be for a month or so, we'll have a better idea where we're at on total dollars, so that if there is some money available for round 3, we would be able to open that up again, and I'm hoping that we can. But we just won't be able to know yet. Once we start processing MOUs, getting receipts back, sending out money, we'll have a lot better understanding on a total basis of where we're at. And hopefully we can find $30,000, $40,000, $50,000 to do round 3. That is the hope. I think it's hope of Greenbush too, is what we talked about. Because when we ran round 2, we kind of thought, well, maybe we'd catch a couple businesses, but we ended up catching a lot more businesses that didn't know about it. So it's my goal that we get around 3 and are able to catch, hopefully, the rest of the
Pick up a few
businesses.
more.
Yes.
Good, okay. I appreciate it, thank you.
Okay. Well,
Mr. Chair, one other thing under new business, I may ask that we go into executive session under attorney-client privilege, two commissioners and counsel for 10 minutes pertaining to contract.
Which contract? Sorry.
With the one we received possibility yesterday.
Right, for the health department.
Yes.
Okay, gotcha.
And we can do that toward the end of the meeting if you want to wait till then.
Yeah, 15 minutes you said?
Yes.
Okay. I do not have any new business. Moving on to old business. Dawn?
I don't have anything, sir.
Jim?
I don't, sir.
Tom?
No, sir.
All my stuff was under old business. I was going to ask about spark funding. We already talked about that. The joint city-county recycling committee, which Dawn and Jim are also on, met on, was it Wednesday? To discuss moving forward. There was some more discussion of the recycling center putting together a 5-year business plan, basically, that they'll present to us in the city for like what specifically they're trying to move toward and what kind of funding they'll need. There was also a considerable amount of discussion about, and this ties into another thing that I was going to talk about, the creation of a local remanufacturing regarding recycled materials cluster, because we have the Kansas Polymer Research Center, PSU's plastics program, as well as PSU putting out graduates that know about plastics. That there's been some desire to look at developing something like that locally that could deal both with local resources, because like the recycling center gathers like plastics 3 through 7 and can't do anything with them, more or less. And so looking at building a local business cluster that would be centered on remanufacturing, basically, that they would develop using recycled materials, something that would be probably an in-between product is kind of what the discussion has been, of like pelletizing plastics that then manufacturers use to make consumer products and that kind of thing. So separately then, there was another committee or group, I guess, that had met discussing that on Thursday. And I think that there's some interest in doing that work of both kind of doing some market research about what could be like where there's a market to be entered into, basically. But then also discussing like kind of local resources, what we're able to do, because there was also some discussion of like there's the tire recycling thing in Cherokee County, and like if there's something that could be done locally that would tap into that as a resource, locally plastic stuff or whatever. So kind of a couple different discussions happening about what we can do moving forward. So there was some discussion of like making a formal committee or something that would work on developing this cluster with the end goal of like getting businesses put in place that would do this, that would create jobs, that would address some of the resource issues that we've been facing locally, and be economic development too. So those are kind of in the works very preliminarily, but there's a lot of interest, I think, in making that happen. So I continue, I want to, participate in that, and I'll keep the county apprised of what that'll look like going forward.
That sounds good. I think that would be great if we could get that up and going, and it would be a win-win all around.
I think so. Well, the kind of the driving force behind it has been Tim Dawsey. He's the executive director at the Polymer Research Center, and he has a lot of connections with private industry, and so kind of has an idea of the pulse of like market trends and the kinds of things that are happening around the country, and where we're kind of lacking here in the middle. That like, oftentimes the most innovative stuff is happening on the coast, that there are things that we can draw from there, but also things that we could be doing here that aren't being done elsewhere. That like we have a close proximity to agriculture, and so there was some discussion about like products targeted toward agricultural use that we could be focusing in on. And so talking to like local businesses, both I guess in the county, but also then maybe regionally, and doing some market research about what that might look like. But at this point, I think the goal is to kind of cast kind of a wide net and just be like, what are the ways we can proceed? I don't think there are any like specific ideas of like, we need a manufacturing thing that's gonna like produce this specific thing. Like, I think it's very like, what are our resources? What are the market trends, and how can we best do something that's gonna have a positive impact here, I think. So I will keep you guys updated on how
Yeah,
that's
that's
going
very
forward.
Really interesting.
Yeah, no, I thought so too. When they mentioned that, I'm like, yeah, I'm gonna be at that meeting, absolutely. And then the CDBG CV grant committee met on Tuesday after our meeting. So we've gotten all of the applications out. There are 9 of them now. So we'll be reviewing those, and Jim got out some of the guidance stuff that we'd gotten from the state to everyone. So I think the plan now is to look over the applications. It sounded like there were still some things missing from several of them. So we'll be reaching out to the businesses to make sure that that stuff gets completed and addressed. And then to start looking at criteria and how we want to kind of grade and determine how much people are going to be getting, that kind of thing.
Good.
So both of those groups, the recycling one and the CDBG CV one, will be meeting next week as well. So I'll continue to provide updates there.
We're
And-
still accepting applications till next Friday, is that right, the 25th, is that what?
Yes.
So,
I was going to say, we still have, I think,
shout out.
there's still enough money to go around given what people have requested. So, yeah, if there's still need, that's a possibility if they want to work through the application, though it is a bit more difficult, but it is still money there. That's all I had for old business.
There was one thing did we want to request a work session for next week for the employee benefits committee? Randy had asked me, they were wanting to come back. Well, she was gonna, well, you take your executive session, she was gonna talk to Christie, because they thought they'd have Christie come and kind of go through some more of the details of what our health plan did last year, as far as, you know, tracking pharmaceutical spending and different things like that. But that's right, she'd come over and talk to me about it, but she was gonna go back and call Christie and try to make sure what one of those days would be best for her and work into her schedule. But we want to go. I'll may have an update on that when you come back from executive session.
Okay, sounds good. If that's all for old business, I'll move that we go into executive session under attorney-client privilege attorney-client privilege
Is that what it'd be under?
Yes.
regarding potential contract regarding the health department for 15 minutes, commissioners and council.
Second.
All right, and we're back in session. Jim, did you have something?
Yes, one more thing that I forgot earlier, under new business, is that we do need to appoint an interim noxious weed director. Tuesday, our noxious weed director resigned, so handed us that letter. So I think it's appropriate to name the person that's been there doing, assisting in the job for 2 or 3 years now, Cord Mays, to go ahead and appoint him as interim noxious weed director until we get the position filled.
Yeah, I think that's a good idea. Do we know if he ever got the contact information back that had been wiped off the computer?
I have not heard. I'm waiting. Tried to call this morning to find out.
Okay, our computer department was gonna go try to retrieve the information, was the last I heard, so,
That's what I understand. So yeah,
okay.
we'll
No.
take care of that.
Okay. Do we need a motion on?
Need a motion on
appointing
that,
him?
please?
I'll move to appoint Cord Mays as the interim noxious weed director until we finish the hiring, or the application process, and have someone hired on officially.
Second.
Thanks, Jim. All right, is there any other business before moving on to future business and announcements?
I talked to Randy, and she
Yeah.
had talked to Christie, and either Tuesday or Friday of next week, they'd like to schedule like a 9 a.m. work session with Christie Mitchell, Blue Cross Blue Shield, and the Employee Benefits Committee to kind of discuss health insurance from, last year's kind of claims, information, and then going forward.
Do we want
It's up to you guys. I don't think there's anything scheduled.
I was gonna say, I don't see anything
We
for,
could do that Tuesday. I may have something for Friday, but I do not have it confirmed yet for a work session.
okay.
Schedule this for Tuesday.
Yeah,
Well,
that's
if you
fine.
may have something Friday, we probably do need to do it Tuesday then.
Okay,
Yep,
that'd be great. We
okay.
can get those people informed, so they'll be happening Tuesday. All right, thank you.
Awesome, thanks, Don. Okay, so, future business and announcements. September 29th, 2020, Mr. Mac Young, Community Corrections Administrative Director, presenting Community Corrections FY 2021 carryover reimbursement budget and the FY 2020 Community Corrections Outcomes Report. Under announcements, so on Tuesday, September 22nd, the commission will have a 9 a.m. work session with the Benefits Committee and Blue Cross Blue Shield to discuss our health insurance. And then October 6th of 2020, the City of Pittsburgh special question election will be held with all 4 polling sites in Pittsburgh open from 7 a.m. to 7 p.m. Is there any other business to come before the commission?
Mr. Chair, if there's no further business, I'll move we adjourn.
Second.